Hi, welcome to the 2.0 conference here in Las Vegas. This is Danny, your host, and I'm excited to have our next guest come on here, Dr. Quang.
Yes, I'm Dr. Q.
Dr.
I'm a
Q.
doctor of physical therapy, fellow of applied functional science, and an expert myofascial release therapist. I founded my company, Perspective Physical Therapy, and we help patients who suffer from chronic pains to even some of the best athletes. I have a special niche in rock climbers, and so I help rock climbers overcome rock climbing injuries and get back on the wall.
Wow, that was good. That was good. So today you got the Healthcare Award Conference Award in Excellence. How did you feel about receiving that recognition, and what are your thoughts on it so far?
Yeah, it was nice to get that award. I think being recognized for the work that you do is always a good thing. But in the grand scheme of things, not super important. It's not like I got this award and it changes who I am. And I'm still doing the things because I feel the need to serve patients in the best way that I know how. And with or without this award, I would still do what I'm doing. But it is nice to have this plaque that I got, and I get to hang that on the wall, and it just lets me know that I'm moving in the right direction.
Yes, and helping people.
You got it.
I feel like that's like, especially with physical therapy, I've greatly benefited from physical therapy.
Oh, perfect.
Yeah. Advice for people wanting to do what you do in your industry. What are their steps? What's your thoughts on it?
So, especially in healthcare, there's a lot of burnout. And I think sometimes you get caught in this echo chamber and you think, man, this is the only way to do things. And I would say if you're in healthcare or a different industry where you're like, man, I want to do something different, but everybody else is saying that's impossible, I would say trust your gut, trust your own intuition, and make sure you're doing things for internal validation and not external validation, right? So, like, for example, got this award is very nice, but that's not the reason why I do anything. But for me, it's, what do I have? I have personal experiences with my own injuries. So I use that as a way to be compassionate towards the patients I have the honor of serving. So making sure you're doing things for yourself, first and foremost. I think other people, friends, family, they're going to have the best intentions for you. But you have to make that decision and not being scared to fail. Failure is part of the process. And I would say just to follow your joy. I think inside you have this innate ability to know what you're drawn towards. And I think sometimes you get advice that steers you away, but I think deep down, only you can answer that.
That's a good advice. That's good advice. Thank you. Thank you, doctor. And networking so far, what's your experience? How have you been doing with networking with other people in the industry here at the conference?
I'll say that this conference is the first time I've been to it. And I think it's been fantastic just because it's not just health. There's also a business conference, there's education, there's all these different industries, to where I think when we sit around and have, shared meals together, whether it's breakfast or lunch, you get this cross-pollination of conversations. And I love that, so I'm talking to someone in business, whereas I'm mostly in health, and the conversations to be had, even though you think, hey, they're different industries, there's a lot of common ground that I think we can learn from each other with. So it's been phenomenal.
Serving the community at large, for sure, I feel like is like, the collaborative approach.
Absolutely.
And okay, so what inspires you to continue to advance yourself in your profession and career?
A lot of it is my own personal experience. I think a lot of times when you find yourself dealing with adversity or challenges, what you don't realize is you're learning the tools on how to get through that. And so once you've learned that, then now you have the tools to help somebody else. So I've had multiple knee injuries, and I always think of myself as the patient that I'm helping. And sometimes what you'll hear that physical therapists will write is a note, and it'll say, patient wasn't responsive to physical therapy. And I've always asked myself, were they really not responsive, or did I not know enough or learn enough to be able to help them? And I've always kind of leaned towards the latter. So I always push myself to kind of learn and grow, just because it's a very vulnerable place to be, to trust somebody else with your health. And I take that very
Take pride in your work.
Take pride, and I just want to make sure that they get to where they can. And if I can facilitate that process, then that's why I do it.
Wow. Yes. And okay, so who is your Mount Rushmore of revolutionary physical therapists?
Great
I'm
question.
like,
Great
let's
question.
also because you do rock climbing clients mainly. Yeah.
Yeah. So I love this question. You know,
Yeah.
the Mount Rushmore is like, who are the four greatest that you would
Yeah.
kind of carve out of a mountain?
Yeah.
And there's two very influential physical therapists that I learned early on, and I went through their fellowship program. But it's Dr. Gary Gray and Dr. Dave Tiberio out of the Gray Institute. They kind
Where's
of,
that at?
it's up in Michigan,
Oh, okay. Okay.
and it's a great program, but more than that, it's great people.
Mhm.
And when you find someone who's doing the right things for the right reasons, you learn the real reasons why you do things. And it's not to work with like professional athletes or the glamour or the fame or anything. It's like, hey, someone is asking you for help, and we're gonna find the right help for you. Okay,
Mm.
so they do applied functional science. It's about doing upright movements. You know, I think a lot of times in PT school, especially, we learn about treatment on the table, laying down, but real life is standing up and in movement. And so there's a huge gap that they were able to fill with that. So that's two spots. They're kind of a combo. They come together. My number three is a physiotherapist and osteopath out of Austria, and his
Whoa.
name is Klaus Isela. He works with a lot of rock climbers, and he has done a lot of contributions for the climbing community and the rehab around that. So I got to learn his finger injury treatment and train under him, and he's played a huge role in how I've run my business. And then the last person on my Mount Rushmore is John Barnes. And so he's also a physical therapist. He's developed myofascial release, which is a hands-on modality where he really treats the being of the human being. You know, a lot of times we'll turn into human doings, and we just find ourselves getting busy and busy and busy.
Mhm.
And he'll challenge us to say, is there anything wrong with being still? And when you're still, your
Yeah.
intuition speaks to you. So it's about this inner journey that he invites us to go on
Like a
within ourselves.
meditative approach to it.
There's a component of that, absolutely.
Okay.
But really asking yourself, you know, like, who am I? What am I doing this for? And what do I hope to achieve in terms of this internal drive? So those would be my Mount Rushmore, and I'm actually giving a talk later on this
Oh,
week
perfect.
about myofascial
Yeah.
release.
Oh,
So
perfect. Yes, in his footsteps.
absolutely.
Yes. Oh, well, thank you for coming on having our wonderful interview. Where can people find you and reach out to you to get in touch with you?
Perfect. Yeah, I'm on social media. My personal is UNU DPT. That's UNU DPT, as in Doctor of Physical Therapy. And then my business account, I mostly work with rock climbers, but I do help other patients that are non-climbers. And you can find me at Complete Climber.
Perfect. Thank you so much.
Thank
Yes.
you.
Enjoy the rest of the conference.
Thank you
Yes.
so much.
Thank you.